Hi, everyone. Today we are joined by Lisa Palmieri, a general pediatrician for mental health and special needs kids, specifically at Altaview. Lisa, thank you so much for joining us. We really appreciate it.
Thank you for letting me talk with you today.
Yeah, so can you describe to us what your specialty is and also kind of what you've been hearing from parents of your patients about their concerns specific with COVID-19?
So, we are still in contact with our patients really regularly. I work for Altaview Pediatrics. I'm a general pediatrician as you said, an interest in special needs kids and kids with autism and uh, kids with mental health issues. So, what I'm hearing a lot right now is that people don't know how to access care. They're afraid their child needs to be seen, but they're also afraid to take them in. And so, we're going to address that, I think, a little bit later on.
Mhm.
But that's, I think, one of the primary things I'm hearing. I'm also hearing that a lot of kids are pretty anxious still after that earthquake. And we can talk about some ways to help calm them down with that. And I'm hearing that parents are really inventive with ways to try to keep things going. And I've been really entertained and really inspired by the number of things that everybody's come up with to try to keep the kids moving and staying healthy at this time.
Yeah, and we've gotten over like 300 aftershocks from that earthquake too.
Yeah.
So I can only imagine the anxiety that they might feel every time something like that potentially happens
Right.
too. So my first question for you is, how can someone create a structured schedule for their child, specifically if they have special needs? That way they can make sure the schedule that they are getting is good for them and their development.
So your families, our families that are doing special needs care, are really in the trenches right now because
Mhm.
many of these children are extremely schedule dependent, and they miss their school schedule and they miss their bus and all the things that they were doing on a regular basis. A lot of them are nonverbal or young, and so for those kids, I would recommend that the schedule is actually made up on paper, and maybe if possible, the child could help develop the schedule with helping put pictures on it. This is also good for young children under the age of 5 who need to know how the day is going.
Mhm.
I know a lot of our special needs population get pretty anxious, and that comes out in behaviors. So I try to talk to my families that if you're seeing a lot of meltdown behaviors, it's anxiety, not naughty. So
Mhm.
we want to look to see in which ways we can help bring a sense of routine back to it. Interestingly, a lot of the kids are happy that they don't have to go to school. Some of my really anxious kids, this has been a bit of a relief from their anxiety, and they love the online school environment. So I'm not hearing routinely that it's overwhelmingly bad. I know a lot of parents are struggling with the technology. I've heard
Yeah.
that over and over, that they don't know how to run the technology the school's sending out. And I don't have a good solution for that except keep communicating with the school.
Yeah, lots of Googling, I'm sure, and I'm sure it's an adjustment for parents who are still working full time too, with trying to get their kids on these
Right.
structured schedules. It's probably very difficult for them. And what are some resources that you guys use for your patients and parents specifically to help them out?
So a lot of the children's special needs children's schools and schools such as Pingree for autism, the Pingree Autism School, Carmen Pingree Autism School, are putting online apps for parents to use. And so make full use of your school's resources. They may be able to give you some OT and PT things you should be doing with your kids at home to kind of further the therapies they would have otherwise gotten at school. And that I know is what most parents are worried about, is that they no longer have access to their special needs therapies in the home environment.
Yeah, and you mentioned something to me earlier about a program called Smarter Parenting. Can you speak a little bit about what that is?
So this is a gentleman that we've worked with. My practice has worked with on and off for several years. He has a website, smarterparenting.com, and he's Facebook Live 3 times a day talking about parenting techniques and advice for this period during COVID. He had a lovely little nature treasure hunt that he put up for parents who could take younger children out on a walk to find these things. He also has a lot on that website to talk about anxiety and fears and depression and sleep. A lot of good, solid parenting advice that would be useful during this time when everybody's under so much stress.
That's great. So, what are some activities that people can do to keep their child developing those social skills during this time as well?
This is probably the only time I've ever told my teenagers you need to be on the screens time more with friends. I've been a little bit surprised when I've been talking to the tween age kids how little they're in contact with their peers. So that's really hard for a tween. It's not awesome for a school age kid, but a tween and a teen will really suffer. I think the teens are a little better at accessing their peers themselves, but
Hmm.
your young tween in the 9, 10, 11 phase may need an adult to get their peers online with them to talk. And I'm kind of recommending a loosely supervised talk. Um, they're meeting with their peers in classroom settings, but that's again supervised by adults, and they're not used to having all their interactions continually supervised by adults. So
Right.
I would loosely supervise, meaning I might be in the room, but maybe not hanging right over the screen, so that the child could have a sense of being able to be with their friends without an adult kind of in the midst of it, guiding it and making it move forward. So
Yeah.
I really would encourage parents who are seeing anxiety or depression in their kids to try to increase their peer contact via screens or other creative methods, whatever people can come up with to make sure these kids still feel part of a social group.
Yeah, I think that's really important, connecting with people during this time. And along those same lines, too, what are some things that kids can do to engage in their sensory skills when they're not necessarily getting that during school right now?
So one of the things that you and I talked about before we got together is my passion for the fact that children are sensory seekers
Hmm.
and they really need input. And any mom who's played with a toddler for a couple of hours knows how exhausting that can be. So part of what I'm encouraging families to do is to think in terms of the child's five senses. What can we bring to that child that will engage their senses in a way and give them more information than they're getting from the standard toys or play or screen time that they're doing? We talked about taking a trip through the spice cabinet, playing with bubbles, going outside and getting some sand and dirt on your hands, planting something, anything we can do to get touch and smell. You could even do some fun things with taste, like lemon and vanilla, just to give some input to this really developing brain that's grasping for data. And it may help reduce some of the meltdowns and anxiety that you're seeing in your child. They just really are not built for this much lack of stimulation.
Yeah. And speaking of anxiety, what are some things that parents can do with their children to help handle and cope with the anxiety that they could feel throughout the day?
So I know this is a really tough time for everyone. And part of the best thing we can do for ourselves is make sure that we as parents are taking good care of ourselves. So making sure you're eating, getting some exercise, and sleeping as much as you can, because this is a marathon, not a sprint right
Yeah.
now. The other thing is to consider practicing some mindfulness twice a day, morning and evening, either with your child by themselves or as your whole family. It could be something quite short. So maybe, with most kids, I think if you can get 5 minutes, you're doing really quite well.
Mhm.
5 minutes of some breathing exercises. For little kids, there's Elmo's belly breathing on YouTube. That's something that we use a lot for our really young kids to help them learn how to breathe. And for older kids, there's something called 4-7-8 breathing that my partner, Dr. Gustin, teaches. You breathe in for 4, hold for 7, out for 8. And when we do this in the exam room, everybody just calms right down. I
Yeah.
think if you could do that for even 2 or 3 minutes, it would be nice. There's a lovely little app called Insight Timer that is free that allows you to set a timer and put some pretty little background sounds behind it. And most people tend to bring these skills in once the anxiety's already gotten high. But if
Mhm.
they're used morning and evening, they may be good preventative skills. Um, to help keep everybody calmer through the day.
That sounds like a skill that everyone should probably
Yes,
practice, just taking a
and
moment for
not just
themselves.
during COVID.
Yeah, I think having the ability to take a moment to yourself is super important. Also, one of the biggest misconceptions right now is that people can't access care and that hospitals aren't safe. Can you describe what you guys are doing to keep in touch with patients who still need care right now?
Sure. So, our in our clinic and in all Intermountain clinics, the nurses' lines are staffed fully, and the on-call lines are available. So you can talk to a provider who's very knowledgeable about what the current recommendations are, 24/7.
Mhm.
Um, in most of our clinics, I have to speak to my clinic because I don't know what's happening everyone else, but I'm pretty sure it's the same. But we aren't bringing any respiratory kids into our clinic at all. So we're bringing in things that are have no chance of being COVID. And we're doing a lot of video visits as well, and I'm doing a lot
Mhm.
of phone work. So I would really encourage, particularly parents of special needs kids, to be in regular contact with their physician about any concerns they have. And we will do our very best to guide you to the best level of care.
Yep.
So there's no need to be afraid of heading into the emergency room. The total viral load right now is very low. There's not much flu, there's not much RSV, and we aren't seeing COVID much in children at this point. So if you and your physician feel like you need to go to the emergency room, it's very safe to do that. They have separated their respiratory kids into one portion of the hospital and their non-respiratory kids in another. So you can come in and know that you're going to be taken care of. All the staff will be wearing masks in all Intermountain facilities
Yep.
starting right away. And that doesn't mean we're sick. It just means that that's our next step to protect patients. And they'll be checking temperatures at the front doors of all Intermountain facilities. And I believe in my building that started yesterday. So I feel like if you and the nurse and the doctor all feel that your child needs to be seen, you can come in knowing that we're taking extra precautions to make sure that your child does not get sick. And that's specifically even more so if your kid is special needs, don't feel like you need to deal with it at home.
Yeah, that's really important. Any medical emergency, whether it's related to COVID-19 or not, is something that you should seek care for.
Right.
Lisa, thank you so much for joining us today. We really appreciate it.
Thank you for having me on.
Of course. And if you guys have any further questions about COVID-19 and would like to speak to someone, you can call our COVID-19 hotline at 844-442-5224. Or you can use our website at intermountainhealthcare.org. There's a symptom checker located in the bottom right-hand corner that can help you walk through what care you potentially could need. Thanks, everyone. We'll see you later.
Thank you.
Bye.
Bye.